All school staff members have an inherent risk of possible exposure to germs and potentially infectious agents on a daily basis. After all, that is part of working in any environment with a high concentration of people. Specifically, body fluids, including blood, vomit, and other fluids, carry the risk of disease. These fluids put you in danger of infection. Teachers, administrative staff, custodial staff, bus drivers, child nutrition staff, maintenance staff, coaches, and more are at risk of exposure to bloodborne pathogens, also known as BBPs. To reduce the risk of bloodborne pathogen exposure, all school staff members need to be familiar with their district's policies and procedures. This training course will prepare you to safely handle a possible BBP incident. Bloodborne pathogens are infectious microorganisms in human blood that can cause diseases in humans. BBPs are carried by millions of people, many of whom are not even aware that they are carriers. BBPs can be bacterial, such as staph and strep, or viral, including hepatitis B, hepatitis C, and HIV. Vaccines are available for some viruses, including the flu, hepatitis A, and hepatitis B. There are currently none available for HIV or hepatitis C. Body fluids that carry BBPs that you are most likely to come into contact with in a school setting include blood, saliva, vomit, mucus, urine, semen or vaginal fluids, and possibly more. BBPs are infectious bacteria, viruses, or other microorganisms. They can enter a person's body in several ways. Some of the most common ways BBPs are transmitted are through cuts, abrasions, and hypodermic needles. They may also enter the body through cavities such as the mouth, eyes, or nose. OSHA has established recommended guidelines for preventing the spread of BBPs. Most states have adopted the same guidelines as OSHA. The state of Oklahoma has opted to recognize the same standards as OSHA in regards to BBP prevention and training. OSHA and the state alike require annual training on BBPs. Universal precautions are procedures that can be used to prevent the transmission of BBPs when providing first aid or health care. Universal precautions are also used to prevent transmission when cleaning up body fluids. You should always assume that blood or other body fluids might be infected and use universal precautions to keep yourself and others safe. Universal precautions require the use of personal protective equipment anytime a school staff member comes into contact with any body fluid while on the job. PPEs include items such as disposable gloves, protective goggles or glasses, face shields, aprons, or other necessary materials needed to place a barrier between the staff member and the potentially infectious body fluid. Many teachers and staff members keep a small emergency kit ready during the school year. Helpful items to include in your own kit are disposable gloves. Nitrile are recommended to prevent any latex allergy reactions, tissue and or paper towels, bandages, antiseptic wipes, and protective eyewear. Remember that if body fluids are present, a BBP danger is present. Your custodial staff are trained to use the appropriate PPE during the cleanup process. If a cleanup is required, send students and other staff members away from the area and contact the custodial staff at once. If sharps, such as broken glass, metal wire, or other materials that may cause puncture or cuts are present, you must make certain that no one touches them. Any cleanup of sharps should be handled by a trained custodial staff member. When cleaning up sharps, always remember, wear PPE such as disposable, puncture-proof gloves and protective eyewear. Pick up large pieces with tweezers or tongs. Sweep up the remaining debris with a broom and dustpan. Disinfect the broom and dustpan following cleanup. Wash your hands immediately using hot water and disinfecting hand soap. After a cleanup involving BBPs, be sure to report a possible exposure to your school nurse or other school official. If you have not yet had your hepatitis B vaccine, consider talking with your primary care physician about getting one.